Let's face it, the very thought of tooth extraction can send shivers down your spine, can't it? Images of sharp tools and a dentist hovering over you may make you second guess even booking an appointment. But here's the real question. Is it really as painful as people fear, or is it the anxiety that gets to us? Tooth extraction is one of the most common dental procedures, typically recommended when a tooth is impacted under your gum, damaged beyond repair, or decayed. And while the idea of having a tooth pulled out might sound terrifying, modern dentistry has come a long way to ensure the process is as comfortable as possible. In this video, we'll uncover everything you need to know about tooth extraction, from what exactly happens during the procedure to the pain level, recovery tips, and even how to mentally prepare. Trust me, by the end of this video, you'll know exactly what to expect and might even feel relieved about the process. So, without any further ado, let's get started. What happens before extraction? Let's talk about what happens before anyone even thinks about pulling that tooth. The process starts with a thorough examination of your mouth and the problem tooth. They'll take x-rays to get a good look at the root structure and position of your tooth. This is super important because it helps them plan the easiest way to remove it and spot any potential complications ahead of time. During this initial visit, your dentist will also go through your medical history. They will need to know about any medications you're taking, health conditions you have, or if you've had problems with anesthesia in the past. What happens during a tooth extraction? Here's where things get real. You walk into the office, probably feeling a bit nervous, which is totally normal, by the way. The first thing they'll do is make sure you're comfortable in the chair. Then comes the most important part, the anesthesia. This is what's going to make the whole process actually painless. Your dentist will start by applying a topical anesthetic, basically a fancy numbing gel, to your gums. This makes the next part, which is the local anesthetic injection, much more comfortable. Yes, you'll feel a very little pinch from the needle, but it's quick and really not that bad. Then comes the waiting game. It takes about 5 to 10 minutes for everything to get nice and numb. Your dentist will test the area to make sure you can't feel anything before they start. Once you're properly numbed up, you won't feel pain, but you will feel pressure. If it's a simple extraction, meaning the tooth is fully visible and not broken, the whole process might take only a few minutes. Basically, the dentist will use special instruments to loosen the tooth in its socket. You might hear some cracking or popping sounds. This is completely normal and not nearly as dramatic as it sounds. It's just the ligaments that hold your tooth in place being separated. While the pressure of the movement might feel strange, you won't feel any pain due to the anesthesia. For impacted teeth, such as wisdom teeth, or when a tooth has broken off at the gum line, the procedure is a bit more complicated. After administering the local anesthetic, your dentist or oral surgeon may use additional sedation options like nitrous oxide, laughing gas, or intravenous sedation if the procedure is more involved. Once you're fully numb and comfortable, the dentist makes a small incision in the gum to access the tooth and remove it. In some cases, the tooth is broken into smaller pieces for easier removal. While this might sound intense, the anesthesia ensures you won't feel a thing. The dentist carefully stitches the incision, if necessary, and provides gauze to help control any bleeding. Many patients are surprised by how smooth and efficient the entire procedure feels, thanks to modern tools and techniques. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Now the big question, does it actually hurt? Here's the truth. During the extraction itself, you shouldn't feel pain thanks to the local anesthesia. What you might feel, however, is pressure or a tugging sensation as the dentist works to remove the tooth. This can feel strange but isn't painful at all. For those who are particularly anxious, some dentists offer sedation options like nitrous oxide, also called laughing gas, or oral sedatives, which can help you feel more relaxed and detached from the procedure. After the procedure, once the anesthesia wears off, usually in 2 to 4 hours, you will feel some discomfort. This is where being prepared makes all the difference. Your dentist will give you specific instructions for pain management, which typically includes taking over-the-counter pain medications before the numbness wears off completely. This way, you stay ahead of any potential pain. For more complex extractions, your dentist may prescribe stronger pain relief. Most patients report that the pain significantly reduces after the first 24 to 48 hours, and within a week, you're likely to feel almost back to normal. What to expect during recovery. Here's your post-extraction survival guide. Right after the procedure, your dentist will place a piece of gauze over the extraction site and ask you to bite down. This helps stop the bleeding and encourages a blood clot to form. The clot is essential for healing because it protects the underlying bone and nerves. During the first 24 hours, you might notice some bleeding and swelling, which is entirely normal. Applying an ice pack to your cheek for 15-minute intervals can help reduce swelling and numb the area. Avoid eating or drinking anything too hot, as this can dislodge the clot. Stick to soft foods like yogurt, mashed potatoes, or soup, and avoid using a straw, as the suction can disrupt the healing process. Over the next few days, you'll likely notice the pain and swelling subside. It's important to maintain good oral hygiene during this time. While it's tempting to avoid brushing altogether, keeping your mouth clean can prevent infections. Use a soft bristled toothbrush and be extra gentle avoiding the extraction site, and rinse your mouth with a saltwater solution a few times a day. This keeps the area clean and promotes faster healing. If you follow these steps, you're likely to have a smooth recovery. When things don't go as planned, sometimes, despite following all the rules, complications can happen. The most common one is dry socket, which occurs when that all-important blood clot gets dislodged or doesn't form properly. You'll know if this happens because the pain will actually get worse around day 3 or 4 instead of better. If this happens, don't try to tough it out. Call your dentist right away. They can place a medicated dressing in the socket that provides almost immediate relief. Other signs that warrant a call to your dentist include severe pain that isn't helped by prescribed medications, fever, excessive bleeding that won't stop after applying pressure, or swelling that gets worse after a few days instead of better. Overcoming fear and anxiety. Let's face it, a lot of the fear surrounding tooth extractions comes from the unknown. The thought of sitting in the dentist's chair, combined with horror stories you've heard, can create a sense of dread. But here's the reality. Most patients find the experience far less painful and traumatic than they imagined. One way to overcome anxiety is to talk openly with your dentist. Discuss your fears and don't hesitate to ask questions about the procedure. A good dentist will take the time to explain each step and ensure you feel comfortable. Some people also find it helpful to practice relaxation techniques like deep breathing or visualization before their appointment. Bringing headphones to listen to calming music or a podcast during the procedure can also help distract you and make the experience more bearable. Remember, dentists perform extractions regularly and are highly skilled at minimizing discomfort. Modern tools and techniques are designed to make the process as quick and painless as possible, so you're in good hands. So, at the end, is tooth extraction painful? The answer is no, not during the procedure, and with proper care, recovery can be smooth and manageable. Now we want to hear from you. Did you or someone you know have a tooth extraction before? What was your experience like? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.